Hello learners, today we are going to discuss about motivational interviewing in substance use disorders. As we know, addiction is a major problem in the society. It is highly prevalent in school and college campuses too. In adolescent and youth, there is a tendency to experiment with the substances like tobacco, alcohol and cannabis. Some of them develop tolerance and become dependent on the substances. Once they develop dependence, it becomes difficult for them to carry out their academic activities and maintain their grades. To get rid of the addiction, they need help from the professional to treat their problems. They also need support from school teachers and family members. However, in substance use, the effectiveness of the treatment depends upon the motivation to change, which actually remains low. Ambivalence about substance use and change, that is quit, is quite common and is considered as an important motivational barrier to behavior change, especially in substance users. This ambivalence can be resolved by exploring the client's intrinsic motivations and values. Motivational interviewing is an evidence-based practice and it can be used effectively to reduce or eliminate substance use and other health risk behaviors. MI counseling style helps clients to resolve their ambivalence. Now, let us see what is motivation. We know that motivation is a dynamic phenomenon. It is a key to change. If it is high, then it helps to resolve the ambivalence, and if it is low, then it lets the client to continue substance use. It is influenced by social interaction. When client has decided not to continue substance use anymore, but when he is in company with his peers who are smoking or drinking, he finds himself vulnerable in such situations. His motivation goes down and he consumes substances. Motivation can be modified by the support from the family members and the key persons in the society. Though to understand the stage of their motivation is the important task for the psychologists or professionals who are working in the field of addiction. Let us see what are the stages of change. Prochaska and Diclemente have described 5 stages of motivation: pre-contemplation, contemplation, preparation, action and maintenance. So, these are the 5 stages of change. Now, let us understand these stages. In pre-contemplation stage, clients are not able to recognize any problem related to their substance use. They do not perceive any negative consequences of their substance use. Clients remain in denial stage, definitely not thinking about changing their substance use, rather focus on the positive aspect of their substance use, for example, relaxing effect of the substance. They are unlikely to have any concerns about their use of substances. They may show resistance to talk about their substance use. In contemplation stage, client is ambivalent about his substance use. At times, he feels his substance use started causing some problems, but at the same time, he may attribute this to other factors like parental discords or punishment given by the parents or teachers. Ambivalent about their substance use when they may be able to see both the good things and the less good things about their substance use. Likely to have some awareness of the problems associated with substance use and may be weighing up the advantage and disadvantage of their current substance use pattern. They are likely to respond to information about their substance related risks, advise to cut down or engage in discussion about their substance use if approached appropriately by the counselors. Preparation stage. Client in this stage are intending to take actions, may vocalize their intentions to others, making small changes in their substance use behavior, re-evaluating their current behavior and considering different other options behaviors, becoming more confident and ready to change their behavior by considering the options available to them, setting dates and determining strategies to change. In action stage, clients in this stage have made the decision that their use of substances needs to be changed, have started cutting down or stopping, are actively doing something about changing their behavior related to substance, have cut down or stopped completely. They are likely to feel somewhat ambivalent about their substance use and need encouragement and support to maintain their decision. In the maintenance stage, clients in this stage are attempting to maintain the behavior change that have been made, working to prevent relapse. The risk of relapse decreases with time, focusing attention on high risk situations and the strategies for managing these, best equipped when they develop strategies for avoiding situations where they are at risk of relapse, are more likely to remain abstinent if they receive reward, support and affirmation. So, the client may remain abstinent or may relapse after some time. As we know, addiction is a chronic relapsing illness, hence relapses are very common. After the relapse, the client may go back to any stage of change, say it could be pre-contemplation, contemplation, preparation or action stage. Counseling by a trained professional or a trained psychologist will also help to modify their motivation towards quitting the substance. The psychologist's task is to understand the stage of motivation and enhance the motivation. There are different psychosocial interventions available to treat such problems. Here, I am going to discuss motivational interviewing (MI) and motivational enhancement therapy (MET). Motivational interviewing is a way of being with the client. Motivational interviewing is a client-centered therapy style for eliciting behavior change by helping the client to explore and resolve ambivalence. It is more focused and goal directed as compared to other forms of therapy. The main purpose of this method is to assess and resolve the ambivalence. Now, let us discuss about the characteristics of motivational interviewing. Motivation to change is elicited from the client and not to be imposed by the counselor or therapist. It is the client's task, not the counselor's, to articulate and resolve his ambivalence. Direct persuasion is not an effective method for resolving ambivalence. The therapy style is generally a quiet and eliciting one. The therapist's job is helping the client to examine and resolve ambivalence. Readiness to change is not a client trait, but a fluctuating product of interpersonal interaction. The therapeutic relationship is more like a partnership than expert recipient roles. MI is an interpersonal style which is not restricted to therapeutic settings only. The spirit of MI relies in partnership, acceptance, compassion for the client and evocation. Now, let us see these aspects one by one. Partnership. There is an active collaboration between therapist and the client. In acceptance, there is a respect for the client and his decisions. The therapist has to show unconditional regard for the client, so the client can share his problems without any hesitation. In compassion, it includes active promotion of the client's welfare and prioritization of client's need. Evocation, motivations, value, strength and resources that the client already have are elicited and explored. Motivational interviewing and motivation enhancement therapy use various techniques. Express empathy. Empathy is a specifiable and learnable skill for understanding another's meaning through the use of reflective listening. It requires sharp attention to each new client statements and the continual generation of hypotheses as the underlying meaning. Some examples to express empathy are: I appreciate how difficult this is change. Yes, making change is hard work, very hard work. That must have been hard on you. If one was experiencing what you are, I can imagine that one would feel similarly. Another technique is decision balancing. When people weigh decisions, they look at the costs and the benefits of choices they can make. Remember that having mixed feelings often occurs when making decisions. Many people change on their own. When they are asked about what brought about the change, they often say they just thought about it, meaning they evaluated the consequences of their current behavior and of changing before making a final decision. Therapist can say you can do the same thing with the cost of changing on one side and the benefits of changing on the other side. This exercise will help the client to look at the good things and less good things about changing. Seeing the full array of the cost and benefits can make it easier to decide to change or not. Let us see with the example of decision balancing. So, in one side you can see the benefits of changing, like increased control over my life, support from family and friends, decreased job problems and improved health and finances. Whereas, the cost of changing would be increased stress and anxiety, feel more depressed, increased boredom and sleep problem. You may not get very easily sleep or sleep will be disturbed. Whereas, what are the benefits of not changing? So, if you continue using substance, you feel more relaxed, more fun at parties, do not have to think about any problem. But what are the costs you have to pay if you continue the substance use behavior? If you are not changing, then disapproval from the friends and family, money related problem, damage close relationship, increased health risks. So, this is the matrix you have to discuss with the client, how the client can see the cost and benefits of changing behavior. Now, let us discuss the develop discrepancy. This is role of the counselor to develop the discrepancy between client's goal and their current problems. It is discussed with the patient how substance use can hamper in achieving their goals. Counselor enables the client to compare his quality of life with other non-user friends and relatives and help him to think where he is and where he wanted to be. For examples, how do you think your life would be different if you were not drinking or smoking? Another example, how do you imagine your life to be like if you don't make changes and continue to drink or smoke? Let us see the support self-efficacy. Self-efficacy is an individual's belief in his own capacity to execute behaviors necessary to produce specific performance attainments. They find it difficult to believe that they can begin or maintain behavioral changes due to recurrent failures. Improving self-efficacy requires eliciting and supporting hope, optimism and feasibility of accomplishing change. This requires to recognize the patient's strength and bring these to the forefront whenever possible. If the patient does not believe that the change is possible, then the feelings of inadequacy to achieve the change may be reduced, which leads to the development of discomfort in the patient or client. Clients must ultimately come to believe that change is their responsibility and that long term success begins with a single step forward. For example, you indicate that you are still struggling with making these changes and yet you have had success at making these things happen. It sounds like you have made real progress. How does that makes you feel? Let us see the role with the resistance. The resistance to change in clients should be understood as a signal that he must be having different views than the counselor. It is generally a signal to change the content of the discussion or listen more carefully. It offers therapist an opportunity to respond in a new or different way and to take advantage of the situation without being confrontational. For example, it is okay if you don't want to quit, it is your choice. Therapist can say like this. Therapist can also say like this, maybe you aren't ready to quit now. So, another technique is avoid arguments. So, there should not be any argument between patient and counselor or psychologist. So, arguments are counterproductive, they increase defensiveness in the client. Attempts to convince the client that a problem exists or that change is needed could precipitate even more resistance in the client. If counselor tries to prove the point, the client predictably takes the opposite side. This can reduce the motivation to change in client. So, the ultimate goal is to work with the client, not to drag them along. For using MI in substance use disorders, some core skills must be developed by the therapist. These abbreviated as OARS, which stands for open-ended questions, affirming, reflective listening and summarizing. Let us see what is open-ended questions. Open-ended questions let the client to provide plenty of details about the subject and let the client express his thoughts and emotions. For example, rather than asking which substance do you use, counselor can ask, tell me about your substance use or tell me about your problem. So, this is the example of open-ended question. Another skill for using MI in clinical setting is affirming. It is a way to express therapist's genuine appreciation and positive regard for clients. It supports and promotes self-efficacy in clients. Counselors may use statements like, I see you, what you say matters, and I want to understand what you think and feel. This also makes the client to understand some insight about his maladaptive behaviors, which are causal root of his distress and discomfort. There are some other statements that you can use, like, you took a big step in coming here today, although things didn't turn out the way you hoped, you tried really hard and that means a lot. Another statement like, that's a good idea for how you can avoid situations where you might be tempted to drink. Let us see the reflective listening. Reflective listening is also a core skill for using MI in clinical setups. It is a key component of expressing empathy. Reflective listening is fundamental to person-centered counseling in general. It helps in communicating in a respectful way to the clients and show the acceptance of clients. It establishes trust and invites clients to explore their own perception, values and feelings. It encourages a non-judgmental, collaborative relationship. It also allows the counselor to be supportive without agreeing with the specific client's statements. Another skill for MI is summarizing. It is a form of reflective listening. It distills the essence of several client statements and reflects them back to him or her. Sometimes it is understood as simple collection of statements. However, it is not just a collection of statements. These statements are intentionally selected that may have particular meaning for the client and present them in a summary that paints a full picture of the clients. Some types of summary are collecting summary, in which therapist recalls a series of related client statements, creating a narrative and reflect on. Second is linking summary, in which the therapist reflects a client statement, links it to an earlier statement. Third one is transitional summary, in which therapist wraps up a conversation or task and moves the client along the change process. Fourth one is ambivalence summary, in which the therapist gathers client's statements of sustained talk and change talk during a session and acknowledge sustained talk, but reinforce and highlight change talk. Lastly, recapitulation summary, in which the therapist gathers all of the change talk of many conversations. Let us see what are the different characteristics of a counselor or conducting MI and MET. So, now we are discussing about the characteristics or skills must be there in the counselors. So, he or she must be genuine and non-judgmental and empathic, expressing acceptance and affirmation, seeking to understand the client's frame of reference, particularly via reflective listening, eliciting and selectively reinforcing the client's own self-motivational statements, expressions of problem recognition, concern, desire and intention to change, and ability to change. Monitoring the client's degree of readiness to change and ensuring that not jumping ahead of the client, affirming the client's freedom of choice and self-direction. By now, we have discussed about various aspects of motivational interviewing. Hopefully, you have understood what MI offers in clinical settings. However, MI offers some other benefits in treating substance use disorders. It is associated with small to strong effect for positive substance use behavioral outcome. Motivational interviewing and MET in client outcomes for alcohol, tobacco or cannabis, and some support for its use in treating cocaine and combined illicit drug use disorders. MI and MET are effective with adolescents, young adults, college students, adults and pregnant women. It is a cost effectiveness intervention and easy to administer. Final word about motivational interviewing. It is effective in helping clients to change their substance use behaviors. When it is delivered in the spirit of MI, the core skills of asking open questions, affirming, using reflective listening and summarizing and enhance client motivation and readiness to change. It has been adapted for use in brief intervention and wide range of clinical settings. It is compatible with other counseling models and theories of change including CBT. And I hope you have understood the concepts of motivational interviewing and motivation enhancement therapy in the treatment of substance use. Thank you all.